My name is Virginia Clute, and I'm at Unique Mind Care to get off of my medication for my ADHD and be able to control myself unmedicated. And I'm here with Dr. Nancy White, who's my doctor, who has helped me phenomenally be able to stop my medicine and actually function without it in life.
So brain training is really to teach the brain to function in a healthier way, more closely resembling a reference database we have of people with the super healthy brains. And so the closer we get to that, the better we function.
I can come in and be anxious and feel hyper, where I have to wiggle around like a crazy person. I'll go brain train for 30 minutes, and when I leave, I'm mellow, I can focus. I get more done now in a day than I used to. So what I was going to explain today was how I understand the brain training to work. Brain training is the mechanism that we use to rewire my brain so that I don't have to use my medicine. To start, we began with a quantitative EEG, which is where you put that little hat on, right?
Mm-hmm.
And cap, okay, little cap that goes over your head like a swimmer's cap. It's kind of what it looks like. And it has little holes in it. And they put these little electrodes on, and they don't shock you or anything. They just measure how your brain waves are working, right? And so what that looks like on me is this. La, 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 la. All over the place, bad. What we want is this, within this certain parameter so that I'm working right. Is that right?
That's right.
Because I'm here outside of the norm, they put electrodes on my head, and I watch a movie. And the movie goes dark when my brain is outside of the parameters where it's supposed to be, where my brain waves are not acting like they should. When my brain does what it's supposed to do, which is inside these little parameters, I get to watch the movie. So I really like it when my brain does what it's supposed to do. Well, that's the first step. So eventually I will get to, like, I guess probably within, 3 weeks it seems I'm already there. You get to here, to where your brain is acting within this correct parameter. But what they do after that is they tighten the parameter. So now you're down here, and your brain has to work in this little parameter here.
Here, and it's really a wave that's going like this, and when
Right.
you look at the EEG, we're flattening it out, and that's why we call it a wave this way when it's really
A circular. And it's really cool, because Dr. White shows you how it all works. She talks about everything. She goes over it all visually.
And so for more information on our treatment, please go to uniquemindcare.com.